I am Jamela Him S. Albis, your student nurse from Camarines Sur Polytechnic Colleges. So for today, I am going to demonstrate the assessing the eyes of the patient. So the purpose of this is to measure how well your pupils work, and also it can help you to point out your eye diseases and conditions that might affect in your brain and also in your nervous system. So without further ado, let's get started. Okay, good day ma'am. I am Jamela Him S. Albis, your student nurse po. So ma'am, can you please state your complete name?
Nicole Saluya po.
Then how about your birth date, ma'am?
July 19, 2005.
Okay, then how about your age, ma'am?
18 years old po.
Okay, so for today, ma'am, I am going to assess your eyes po. And in order for me to do that, I will be needing your full cooperation. So is that okay with you, ma'am? Okay. Okay, so before I came here, I already provided the client's privacy to make the patients comfortable and safe. Then, before that, I am going to perform the hand hygiene to prevent the transmission of microorganisms from one patient to another. So before going to the procedure, I am going to examine the external eye of the patient. So first, I am going to inspect the eyelids and lashes of the patient for the position and arrangement and appearance of the eyes of the patient. Okay, for the findings, the eyelids margins, it is moist and pink, and also the lashes is short and it is evenly spaced, and also the lashes also in curved and outward. So, okay, so ma'am, can you please blink? Okay. Okay, so for the blinking of the patient, it is symmetrical and it is also involuntary, approximately with 5 blinks of the patient. Then next, I am going to inspect the conjunctiva and also the sclera for clarity and appearance by separating the thumb and also the index finger by asking the clients to look up and down and also look to side by side. So ma'am, can you please look up, down po, then side naman po. Okay? So, for the findings po, so for the bulbar conjunctiva, it is clear with tiny tissue and it is visible into your peripheral conjunctiva, and it is pink wherein it is no discharge po. Okay? So, okay, then next I am going to inspect the cornea of the patient. So, okay. Okay, so for the findings, it is transparent and also it is smooth and also it is moist. Okay. Then next, I am going to inspect the iris and pupil for the shape and also the equality and for the color. So, okay. So for the findings, for the shape, it is round, and also for the equality, it is equal. And for the color, it has a uniform color. Okay. So we can now proceed for the size of the eyes of the patient. So it varies from 2.5 millimeter or 4 millimeter that depending upon from the illumination. So okay. Okay, so as I can see, the size of the eyes of the patient, it is myotic pupils wherein it is less than 2.5 millimeter. Okay, ma'am, before we go to the procedure, I am going to ask you something po. So, did you notice recently any changes in your eyes po, like in your vision po, like double vision, blurred vision, or cloud vision po? Okay, so how about eye pain, ma'am? Wala naman. So, redness or swelling? Wala. So, any eye discharge po? Wala naman. So, for the history of proper eye surgery po? Wala naman. How about ma'am trauma po? Wala naman. So, do you use any corrected glasses po, like contact lens po?
Once po.
Okay, once. So, meron po ba kayong eye care habits po? Inalagan niyo po ba yung eyes niyo po?
Opo.
Meron. So, ma'am, are you using sunglasses or any anti-radiation glasses?
Anti-radiation lang po.
Okay, so thank you, ma'am. So, are you taking any medications po, ma'am? Wala naman. Okay, we can now proceed to the procedure. I am going to assess the acuity test. So, and then we are using the Snellen chart to assess the cranial nerve number 2, which is the optic nerve. So, okay, we can start na po. Then next, ma'am, we are going to assess your visual acuity test. So, what we are going to do, ma'am, we need to get away. We need to get away 20 feet from the Snellen chart. Okay. So, ma'am, can you please read po the red line in the Snellen chart? But first, ma'am, can you please cover your ano po, right eye? Then, read po the red line.
D, E, F, T, O, T, E, C.
Okay, then how about in your ano po? Left eye naman po, ma'am.
D, E, F, T, O, T, E, C.
Okay, okay ma'am. So, both eye nyo naman po siya ma'am babasahin without covering your eye po.
D, E, F, T, O, T, E, C.
Okay, so the client's vision is 20/20 and wherein it is the patient has a normal vision. Then next, ask the client to hold the Jagger chart. So, ma'am, can you please hold the Jagger chart for me? Okay. So then next, I am going to measure 14 inches away from your face po. Okay. So ma'am, can you please read the smallest line for me po? This one po.
The forests and the morasses of Germany were filled with a hardy race of barbarians.
And next, I am going to assess the peripheral vision of the patient. So face the client at 2 to 3 feet away from the client. So assess the client to look straight ahead. Then cover the opposite and then cover the opposite eye of the patient. So ma'am, can you please cover your eye po? Okay ma'am, tingnan niyo lang po yung ballpen. Then sundan niyo lang po kung saan po papunta yung ballpen po. Okay? Okay? And then, on the other side naman po, ma'am. Sundan niyo lang po yung ballpen. Okay? So, as I can see the patient, it's seeing the object wherein it is moving at the same time, it is in the peripheral movement. Then next I am going to assess is the EOM, which is the extraocular muscle test. So, okay, so ma'am, you need to stare at a distance object po. So ma'am, I am going to test your extraocular muscle. Okay, and then the other side naman po. Okay, ma'am, I can see that there is an alignment in your eye and it is also symmetry in your eye wherein it is normal po. Then next, I am going to assess the superla. So wherein it is the light equal to round reactive to light accommodation. So I need to darken the room. So I need to turn off the light for the accommodation. Then ask the client to look straight ahead. So ma'am, can you please look straight ahead? Then move the pen light side to side. And the other side. Then next I am going to demonstrate is I am going to assess the ears of the patient. So the purpose of this is to maintain the proper hearing and functions of the patient. So before we started the procedure, ma'am, so I am going to ask you some questions. So is that okay with you, ma'am? Okay. So ma'am, did you notice any recently changes in your hearing po? Did you feel any ear pain po? So did you hear any ringing or cracking in your ear po? So then how about ma'am dizziness or balance spinning? Okay ma'am, so how much did you take any toxic medication like microlide or anti-microlide malaria po? Then we can now proceed for the assessment. So I am going to inspect the size and shape of the ears of the patient. So the ears of the patient is in equal size and it is also in similar appearance. And for the position, it is normal. And also the lashes and discolorations is normal. And then the skin, it is smooth. And also the skin color, it is brown. And then the consistency is normal. And then we can now proceed to the procedure. Then next I am going to assess is the whispering test. So I am going to give instructions to the patient. So ma'am, I am going to say something po or words and you need to repeat it po for me. So is that okay with you, ma'am? Okay, so but first I am going to move 2 feet away from the patient. So ma'am, I am going to say something in whisper po and you need to say repeat it after me po. Okay, but first ma'am, can you please cover your right ears po? And then I am going to say something po in whisper and you need to repeat it after me po. Okay?
1, 2, 3, 8, 9, 10, 11, 12, 20, 80.
Okay? And then on the other side, so ma'am, can you please move? Okay, ma'am, I am going to say something po in whisper. So ma'am, can you please cover your left ear still po? Okay.
19, 25, 98, 20, 14, 18, 9, 10, 30, 35, 40, 45, 46.
Okay, thank you, ma'am. The next procedure that I am going to do is the liver test. So I am going to give instructions to the patient that I am going to place a tuning fork on the top of his head and then I am going to ask her if she hear an equal sound on his in both ears. Okay. So let's just assume that this is the tuning fork. So ma'am, I'm going to tap the tuning fork and then sabihin niyo po ma'am kung narinig niyo po yung echo in your both ears po.
Yes. Yes.
Okay. Thank you, ma'am. Then next procedure that I am going to do is the Renee's test. So now I am going to give instructions to the patient that I am going to place a tuning fork on the base of the ears of the patient. So ma'am, I am going to place the tuning fork on the base of your ears po, and then you are going to tell me when you hear the sounds and when it will stop po. Okay?
Lara, dito mo pinakakain natin. Ale!
10 seconds.
Okay? And on the other side.
12 seconds.
Okay, thank you, ma'am. The next procedure that I am going to do is the Rumberg test. So assist the client to stand erect with both arms together, then with feet close together. Okay, ma'am. So, ma'am, can you please open your eyes for about 10 seconds? So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So, ma'am, can you please close your eyes po for about 10 seconds naman po? Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so as I can see on the client's position, I noticed that the patient is in imbalance, and I also noticed for swayingness of the body's position, wherein the client is in positive for the Rumberg test. So for the procedure, I am going to auscultate the heart of the patient. So I am going to use the stethoscope. Then I am going to use the diaphragm of the stethoscope to identify the sound of S1, the first sound, and the S2, which is the second sound. So the sound of your heart, ma'am, is normal naman po. Then last that I am going to demonstrate is I am going to assess the neck of the patient. So I am going to assess the carotid artery of the patient. So I am going to find the pulse of the patient using my 2 fingers. Okay. Okay, so after we find it, I am going to use the stethoscope using the diaphragm. Okay, so the carotid artery of the patient is in normal. Lastly, document all the relevant information in the client's record. So that concludes my demonstration in assessing the eyes, ears, heart, and neck.